Good morning and welcome to the European Healthcare Climate Summit. My name is Mireia Figueras Alsius and I am joining you live from Brussels. I'm the Climate Program Manager at Healthcare Without Harm Europe and I will be moderating some of the sessions of the 2024 Summit. It is my privilege to welcome you to the 6th edition of this annual event. Today is a packed day of great sessions and learning opportunities. The theme for this year's conference is Building Climate Resilience and Net Zero Healthcare. What's next? We are always humbled and encouraged by the reception this conference attracts. We had more than 350 participants registering for the conference this year. It is truly an evidence to the passion and commitment that exists across Europe and beyond to drive the movement forward. Before I introduce our keynote speaker, I would like to briefly discuss some of the platform's features and highlights. On the right-hand side of your screen, you will find lots of options to explore. I want to draw your attention to the live chat tab. From here, you can share thoughts and comments with all other attendees. Let's try it together now. Please let us know where in the world you are joining us from today. Just type your city or country into the chat box. We'd love to hear from you. The same chat box is where you can post questions for any of our speakers during the sessions. And if any questions are not answered during the session, our speakers can return to this at any time and offer you an answer or connect directly with you on the platform. Actually, you can also reach out to any of your fellow attendees or speakers. To do this, go back to the reception page and click on People tab at the top of the screen. And from here, you can send anyone a direct message or even bookmark any speakers or attendees you want to connect to. At the end of the day, following our main sessions, we will have an opportunity to continue the conversation through our networking roundtables. There are 3 topics available for more focused discussions: decarbonization, healthcare climate resilience, and healthcare professionals. To join those sessions, you simply go to the Networking tab at the top of your homepage at 3:45 Brussels time. You can choose a seat at the roundtable that interests you the most. And remember that at any point of the day, you can see the order of the day and the topics that will be covered in the Agenda tab, also at the top of your homepage. All the topics are listed in chronological order. Just make sure that you join the right session by clicking Morning Session or Afternoon Session. After the summit, all the sessions will become available to rewatch on demand and will be available for 4 weeks after the conference closes. In fact, the platform remains open for networking too. But don't worry if you get a message and you are not logged in, because the platform will send automatically an email to let you know that somebody has reached out. Lastly, we encourage you to check our virtual booth. There you can explore some of our resources that we have available to support your climate action journey. And now, enough of practicalities. Without further ado, I would like to welcome to the stage Mark Wilson, the Executive Director for Healthcare Without Harm Europe. Good morning, Mark.
Good morning, Maria. Thank you very much for that introduction. And good morning to all of you who have joined us today, which I know includes healthcare professionals, sustainable healthcare leaders, and members of our Global Green and Healthy Hospitals Network. It's a pleasure to welcome you to the European Healthcare Climate Summit 2024. As you heard, my name is Mark Wilson, and I'm the new Executive Director of Healthcare Without Harm Europe after a career leading organisations in the health, international development and humanitarian response sectors. This includes 9 years as CEO of Cochrane, the world's preeminent producer of healthcare evidence with a global network of 158,000 members and supporters, producing and disseminating over 7,500 systematic reviews in the Cochrane Library. And before that, I spent 11 years with the International Federation of Red Cross and Red Crescent Societies, leading humanitarian and development operations around the world and leaving as a member of the senior management team in Geneva. Now to real business. As Maria said, the theme of today's summit is exploring solutions and new areas for action in sustainable healthcare. More specifically, we want to identify with you improved strategies for building climate resilience and net zero healthcare systems. I'm proud that Healthcare Without Harm Europe is at the very forefront of promoting sustainable healthcare solutions across the continent. Our mission, for those of you who may be new to our work, is to transform healthcare into a leading sector in the fight against climate change, accelerating the transition worldwide to a low-carbon economy. In recent years, the healthcare sector has made significant progress, but key challenges remain. We're focusing in this summit on three of the most important ones. First, addressing supply chain related emissions remains a major hurdle, and even the most advanced healthcare organisations are struggling on this front. In 2009, at the inaugural Healthcare Without Harm Climate Summit, we took a critical first step in understanding the scope of the challenge before us, quantifying the total emissions from the healthcare sector. Since that initial assessment, a clear vision has emerged. We know where we need to go, to a decarbonised healthcare sector that continues to deliver the highest quality of care whilst dramatically reducing its carbon footprint. But knowing where to go is the easy part of the challenge. As I know you know, the how to get there was and is the next critical step. In more recent summits, we've heard directly from system and health facility leaders about the steps that they are taking, from calculating their emissions to identifying reduction targets, developing plans and implementing mitigation solutions. Healthcare Without Harm Europe has developed strategies and frameworks that help them to do this. Yet, as we discuss this pathway to carbonisation, it is clear that you, as sustainable healthcare leaders, are grappling with complex issues, like accurately calculating your carbon footprint and reporting efficiently and effectively on your own emissions, especially of the elusive Scope 3 kind, those indirect emissions from supply chains, procurement and waste management. While many strides have been made, significant questions remain unanswered. Healthcare organisations are balancing their ambitious climate goals with regulatory demands, operational needs, and of course, limited resources. These challenges are not just theoretical. I know they are your daily realities, the realities that hospitals, clinics, and healthcare systems face every day as they work to decarbonise. That said, progress is undeniable. Across Europe, we are witnessing examples of innovation and determination. There are healthcare organisations that have already made remarkable progress, and today we will hear from national health systems, regional networks, and individual providers who are leading the way. They will share concrete solutions to the mitigation challenges we face, highlighting innovative ways to measure, report, and reduce emissions across all scopes. A second critical challenge is preparing the healthcare sector to effectively address the impacts of climate change. In addition to reducing its own climate impact, the healthcare sector must become much more resilient, able to withstand and adapt to the health risks that climate change brings, safeguarding the well-being of both patients and healthcare workers. As you all know, climate change is no longer a distant threat. It is here now, intensifying pressures on an already strained healthcare sector. Changing disease patterns driven by shifting vectors are leading to the spread of diseases in regions previously unaffected. At the same time, extreme weather events, floods, heat waves and storms are becoming more frequent and severe, directly impacting hospitals and healthcare infrastructure. Healthcare systems and facilities must be prepared to foresee, respond to and recover from these climate-related challenges. Building climate resilience is about more than emergency preparedness. It means embedding climate adaptation into the core operations of hospitals and healthcare systems. During today's conference, we will hear real examples of how healthcare organisations across Europe are already implementing tangible measures to enhance their own climate resilience. And finally, we cannot overlook the critical role that health professionals play in driving this transition. Doctors, nurses, and health workers are not only on the front lines of patient care, but also at the forefront of that climate health conversation, and is not an easy place to be. A significant obstacle to climate action is public and political will, and the role of healthcare professionals in making this issue salient cannot be underestimated. We are proud to directly support healthcare professionals to use their trusted voices to drive change. Building sustainable healthcare resilience viewed holistically also means adapting to support the emotional and mental well-being of healthcare professionals, which is just as important as adapting infrastructure, governance and strategies. We are thrilled today to welcome speakers to the summit who will address this essential element of sustainability and long-term resilience. Today's summit and the focus of its agenda is therefore an encapsulation of what's next in the transition to net zero and climate resilient healthcare. We all know that we must move as quickly as possible to make impact at scale across the whole of Europe. To deliver that scale of change, Healthcare Without Harm believes that collaboration, innovation, and advocacy are key drivers of progress. These three things have taken the sustainable healthcare movement this far already, and they will keep it moving forward. Through Healthcare Without Harm's Global Green and Healthy Hospitals Network, which has over 2,000 members worldwide, we have seen what can be achieved through collaboration. We are now forging new healthcare professional networks to support doctors, nurses, and pharmacists in their work to implement meaningful change. For those of you who may not know very much about these networks, we encourage you to reach out to us to learn more, and we hope join us in them. What's also key is to support innovation. Our role at Healthcare Without Harm Europe is to work side by side with everyone working across sustainable healthcare to share insights and inspiration and develop pilot projects which can then be scaled up to provide practical, tangible solutions across Europe. That is why today we will focus on discussing and sharing proven, replicable methods and practices to help us overcome these challenges and develop common approaches to doing better. To conclude, I know that you all share Healthcare Without Harm's belief that the healthcare sector must be at the forefront of addressing climate impacts and has a duty to lead by example. As my predecessor, Will Clark, said this year at the Clean Med Europe conference, sustainability is the big thing now, meaning more and more people across the continents are opening their minds to the necessity of climate action and the myriad of benefits for people and the planet that taking climate action now offers us. We know that no single organisation or sector can address the scope of climate change alone, precisely because we know that the challenges facing us are complex and interconnected, and the adaptation and mitigation required are huge in scale. So we must act together, and we are thrilled to have you as colleagues and partners in this wonderful shared endeavour. I wish everyone a productive and inspiring conference today. Thank you very much.
Thank you, Mark. I think that this really sets the tone wonderfully for the rest of the day.
My pleasure, Mireia, and I wish you and all the participants a tremendous day.